See Destiny Productions presents Power to Win with Dr. Valerie Daniels-Carter. Expect a powerful half-hour broadcast that allows you to engage from the business world to the spiritual world, to be inspired and to be informed. Remember, you have the power to win with Dr. Valerie Daniels-Carter.
Good evening and welcome to Power to Win, the reality of recovery. We, on last week, had a phenomenal session with Dr. Tito Izard. You need to go back and listen to part one of this session. We're dealing with the physical side of the recovery. And as we live through this season, as we manage through this time, we need to know how to physically prepare ourselves and what we can do in order to achieve. Dr. Izard's bio can be found online, but just let me tell you, he is one of the greatest physicians and has been voted number one several times as Milwaukee's best family physician. He has over 20 years of experience as an educator, instructor, and chief administrator of medical practices with emphasis on urban health issues. In 2006, Dr. Izard left academics to dedicate his practice to the central city of Milwaukee, Wisconsin. He currently serves as the president and CEO of Milwaukee Health Services. Go back and listen to last week's session on the physical health. Doc, thank you so much for being with us on this evening as we navigate through these turbulent times, as we manage through actually a landscape that we've never seen before. It's never been drawn this way before. I need for you to help our listeners to understand this whole COVID environment and brief us and give us an overview of what really is COVID-19.
Well, thank you. Thank you again for having this discussion and to your audience. It's great that they're taking time to learn more about themselves, their body, about how to stay healthy, and especially this, COVID-19 virus that is just, ravaging our community and the world, unfortunately. So, just very briefly, I know a lot of people have heard lots of conversations regarding the virus. So, just first of all, let's just start out. When we talk about the virus's name is SARS-CoV-2. That's the name of the virus. But what most people here is talking about is coronavirus or COVID-19. Now, this will briefly explain what it is. So, coronavirus is a family of the virus. So, for example, if your last name is Johnson, you're one person in the Johnson family, but the Johnson family have many different members. So SARS-CoV-2 is the one specific virus within the coronavirus family. Coronavirus is a virus that causes the common cold. And so that's why there is a lot of overlap between the symptoms of what we call COVID-19. And COVID-19 is just kind of the name that we use because it was identified and the pandemic began in the world in 2019. So COVID-19 is the same thing as the SARS-CoV-2 virus, but coronavirus is the whole family. It is not, and so it's important for us to understand the difference.
So corona is all the children.
Coronavirus is all the children. So if you have a common cold, if you have anything that's cold-like, it may be in the coronavirus. The virus that's causing it may be one of the children in the coronavirus family.
Okay.
But there are other family members that have very similar flu-like symptoms or cold-like symptoms. So it's not just the coronavirus only. And for this discussion, we're going to talk about all the other different viruses, but there are a lot of different things that are actually out there.
Wow, that's interesting. So what are the symptoms? How, you hear so many different, I'll call it definitions around whether or not if you have these symptoms, you should go get it checked immediately. What are the symptoms? What are the manifestations of this coronavirus or SARS epidemic?
Yeah, and just for simplicity, we'll just talk about COVID-19. So COVID-19, we're talking about this specific virus.
Okay, and, daddy of them all.
Yeah, we're just gonna keep it really simple.
Okay.
So when it comes to this virus, those symptoms are really those really basic types of symptoms. So if someone typically was starting off, the person may have a fever and cough, and you may not necessarily know kind of what the difference that's going on. But fever, it can be a part, again, I'm going to name a couple of different things, but it doesn't necessarily mean that it is only this condition. So a person, specifically for the COVID-19 virus, they can have cough, they could have some breathing troubles, they may have a runny nose or a stuffy nose, they could be tired or we call fatigue, we can have headache, we can have body aches or muscle aches, fever we talked about, sore throat, chills, and then this, some people may even have some abdominal symptoms, and then this loss of taste and loss of smell. This was discovered later on as the virus was starting to spread, that people had this unusual just loss of taste and or smell. So those are common symptoms that could be related to the COVID-19 virus. What is interesting, though, is those symptoms, along with flu symptoms, what we call the seasonal influenza virus, are very similar, okay? And it is impossible for you to distinguish whether this is the flu or whether this is COVID-19.
Wow.
Only way for us to know the difference is when we do our laboratory testing of it to be able to know the difference. You cannot tell by symptoms alone. Now, if someone's only symptom is loss of taste or smell, then that is aligned more with the virus, the COVID-19 virus, and not the flu. But if that was the person's only symptom, even as a healthcare person, we would say that could be the virus, but you don't know if that is the reason why they lost their taste or smell, right? And so you still want to test to confirm it. Now, this is something that's really interesting for everybody to remember. If you have sneezing is not a part of the flu, nor is it a part of COVID-19. Okay, that is typically seen with the common cold. All right, so if that's one of your main symptoms, that kind of goes along with the cold, and that goes along with allergies. So in Wisconsin here, in the month of late October, when you're trying to figure out, well, is this my allergy symptoms? Is this my cold? Is this the flu? Or is this COVID-19? And you can see how hard it is to tell the difference between the two. And that's why it's important to have a relationship with your healthcare provider so that that person can really help you kind of work through what's going on. Now, if you have a known exposure, an exposure with COVID-19 means that if you've had contact with someone within 6 feet and for at least about 15 minutes, then that means that is what we define as close contact exposure. And in those cases, we would want you to treat yourself like it is COVID-19 until you're able to have a discussion with your healthcare provider and possibly get tested.
So let me ask you a question, because that was very interesting to me. You said within 6 feet and about 15 minutes of time with that individual. Let's say first.
So in other words, if you just cross somebody in the hallway, you don't need to panic and worry, about that. It's obviously something you want to pay attention to your symptoms over that 14 days, but you really don't have to panic about having a brief exposure with somebody in that situation.
Well, that's a big misnomer out there, because people think, man, I just walked past somebody, they had COVID, I'm dead, I'm out of here, That is very powerful information to know that it really does mean that you have spent a few minutes in dialogue and in an environment with someone versus just having a brief passage or so.
No, not just dialogue though. So number one, it's not the cooties. So
Okay.
you don't have to worry about it like that, okay?
Okay.
People are panicking too much. And this is why it's great we have this discussion to be educated. But also, number two, it does not require you to have dialogue with a person. So, for example, if a person who has a COVID-19 virus is in an elevator or in a room, and that person was coughing in that room, and they left out, and you came in 10 minutes later, and you spent 15 minutes in that room, you could get the virus.
Wow.
Because the virus can suspend itself in the air, for let's say 30 minutes. And so if you come into that space where that person, especially a tighter space, usually wide spaces isn't as much of a problem. But if you're talking about a small location like a car, for example, ride an Uber or something like that, or an elevator, something where you're going to be in a tight space. If you find yourself in those type of spaces, that's why it's so critical and so important that everyone wears a mask. So let's get it out real quick, right? So number one, make sure that you are wearing a properly fitting mask, okay? Mm-hmm. And there's lots of different masks out there. I say get the best mask that you can to be able to utilize, all right? And if it's a washable mask, make sure that you're cleaning it regularly, and then when you're taking it off, you're assuming that there is virus on the mask when you're taking it off and storing it. So use it put it in a paper bag, for example. And if you have to take it out, making sure you take it out a certain way. Because you could be doing everything great, but you could infect your own self because you weren't paying attention, you took it out, you didn't sanitize your hand, and now you touched your face, your eyes. So number one is make sure you're wearing a mask. Number two is making sure you're keeping that physical distance that we talked about, that 6 feet. And then number three is about making sure you do hand sanitizing. So keep your hands clean, either wash your hands, but if you don't have access to a sink, making sure you use hand sanitizer front and back and in between your fingers to make sure that if the virus did get on your hands. Now, another thing I like people to know about, because most people keep forgetting, is not just wearing a proper mask that covers your nose and your mouth. The virus can get in through your eyes. So if you're in an environment, a high-risk environment in a tight space, you do need eye protection because if someone's speaking to you, that virus can go and get into your body through your eyes.
So, Doc, are there certain sectors of individuals more vulnerable to this virus? Early on, they were saying people that had, a number of conditions, elderly. Now it seems like they're redefining who is more susceptible to this virus. Are there certain individuals or sectors or ethnicities that are more vulnerable?
Yeah, and that's another misunderstood thing. When it comes to the actual virus, everyone is at risk of being exposed to the virus and contracting the virus. Not everyone has the same consequences or the outcomes as a result of the virus. So when we talk about, these different groups, the elderly are not necessarily going to attract the virus more. They're just they're going to suffer the consequences. They're more likely to develop more severe symptoms than a 7-year-old, for example. But it doesn't mean that the 7-year-old is immune. It just means that that 7-year-old is less likely to have symptoms. Mm-hmm. And that's what makes it really difficult too, because now there's so much misinformation regarding young people and the virus and acting like they're immune. They're not immune to it. You just may never know that they actually had it because they were exposed, their body naturally defended itself, and so they may have neither expressed symptoms. Okay, mm-hmm. So they may have been exposed, meaning the virus is present in their body, but they may have never been infectious, meaning being able to infect another person. Or it may mean that person's immune system took care of it and prevented very few symptoms. But it didn't mean that they never got exposed in the first place. And the problem is that we don't know which child, which adolescent, which young adult, and which elderly person is going to have more severe symptoms. So everyone has to protect themselves doing the things that we talked about to make sure that you don't bring the virus into your body or onto your hands and pass it on to somebody else who may experience a greater complication as a result of it. Complicated groups would be, the older we get, we have higher risk. And then we know for a fact that historically vulnerable populations such as African Americans, Latinx community, Native Americans and such, typically those that have other chronic health diseases are more at risk. Now, a lot of the reasons why minority populations like African Americans are more at risk is because of those things we talked about in the previous session about looking at us as African Americans in particular. We typically live multi-generationally. We live in a more closed network environment, in the community. Right, we typically ride the bus or public transportation more. We typically have lower wage jobs that are essential workers that puts us at a higher risk of the public. And so all these other factors that increases our likelihood of exposure. And then it's also more difficult in our communities to find access to disinfectant agents, hand sanitizers, and masks as someone in the majority community or someone who has greater economic resources, where they can drive 10 miles out to Costco and go pick it up, where for us, we rely on what's available in our neighborhood stores.
So, Doc, vaccine. You hear so much controversy about the vaccine, whether or not
dun, dun, dun.
whether or not it's the right answer. Historically, it's taken years to come up with vaccines that are even 40% effective. And all of a sudden now, in less than a few months, we have vaccines that we're trying to infect people with. How do we know whether or not to step into the world of, yes, vaccinate me, or let me just wait and see?
Well, and that is actually, I don't have a great answer to you for one, because the vaccine is currently not available, and there are a number of different vaccines in competition. So it's hard to speak about the success of a vaccine that doesn't exist yet. One thing I do want to make it very important, though, that every single person in your audience should be getting a influenza annual flu shot. For one, because we just talked about all of the symptoms that overlap each other. The last thing you want to happen is have a bad flu season and a bad COVID-19 season going at the same time. You talk about panicking, people will be freaking out, right? Let's just be honest. So it's extremely important in this flu season that you do get a flu shot to reduce your risk of influenza, okay? Now, one of the things that people don't necessarily know, they say, well, why should I get a flu shot? Because it doesn't work anyway. What happens with the flu shot, the scientists are trying to predict from 6 months ago, they look in the southern hemisphere of the world and look at the virus that's happening, the influenza virus that's happening in that part of the world, and anticipating 6 months later when it comes to the northern hemisphere where we are here in our country, and see if that virus is going to be present. So it is really trying to anticipate. So it's a hit or miss. And on an average, it's only going to be between 40 to 60% effective, the flu shot. But it's still important that if we still vaccinate as many people as possible, we can reduce the presence of that virus. I tell everybody, anytime I talk about vaccinations, that my father, who was a healthy person at 56 years old, died from influenza in the year 2000. Okay, so people do die from influenza. And I was, at that time, I had just finished my residency. So we're talking about the father of a doctor. I went to see him on Friday. He said, oh, I just got the flu, I'm okay. The next day I got a call. He was in the emergency room. And the next day he had passed away. And so it's unfortunate. These things happen, especially in the African American community. And so it's one of those things we have to take seriously. So, right now, definitely get the influenza vaccination. I think we all should be paying attention and having really good conversations with our healthcare providers when it's time for the COVID-19 vaccination so that we can make informed decisions. But one thing that we know, if you don't get it, you're not getting any protection. So 4% protection may be better than nothing.
So you would encourage people to get the flu shot. Let me ask this question because, and I know as a professional, if you don't want to answer it, please, I want to keep you in your day job. You've heard many individuals talk about the microorganisms that they're putting in these vaccines that will allow them to trace you as a person or control your emotions and do a number of things. I listened to some scientists speak last week on the different components that they can add to a vaccine that will create an environment of and I'll call it the Antichrist environment. Is it possible to actually include in a vaccine a microorganism or whatever that can do more than just prevent you from maybe getting the flu or getting COVID or something like that, but can be a controlling factor of one's emotion or one's personality? And we only have a couple minutes, so they're going to kick me off in about 3 minutes with my time limits.
Yeah, well, I'm not familiar with that conversation that people may be having, but I would say I would give no credibility to that conversation, mainly because as a believer, I believe that, once the Spirit is in you, then you've been delivered from everything. Now, that doesn't mean that you won't experience hardship or tribulations, but it means that you've been delivered from the consequences of all of those things. So it's no wonder world I believe that anybody can inject me with anything to create an Antichrist environment if Christ is already filling that space.
I love it because you can't have Christ and the enemy resonate in two bodies.
They're not equal.
They're not equal.
Right?
They're not equal. They're not equal. And so when you have made a declarative statement that I am a believer and I'm covered by the blood, you may have situations. You may have storms. You may have medical conditions that Dr. Izard has to take care of. But there is a promise that you have. And the reality is that we will, as believers, recover. Whether we recover on this side or the other side, we will recover. And so I would encourage you to continue to keep yourself healthy. Continue to remain informed. Education is the best thing that you can have when it comes to understanding what you need in order to ascend to new horizons. You have the power to win. You will win, and we shall do it together. Won't you close with me in prayer? Father, for this time that we've shared today, we thank you and we praise you. Thank you because we know that you are the God of all things and of all flesh. So we praise you, we glorify you, and we give you all the honor for all the things that you shall do. Now continue to heal those that are sick. And God, I ask that you will continue to bless those that have been infected with this disease and bring us out is my prayer in Jesus' name. Amen. Dr. Izard, thank you so much for joining with us on tonight. You have been so very, very helpful in us understanding more about health.
Thank you so much, and I'm so glad you're delivering this message. And just remember that our bodies don't belong to us. We are a vessel to be used for good. And if that good is in you, you don't have to worry about anyone being able to taint your good.
Thank you so much, sir. God bless you.
All right, you too.
Again, thanks so much for joining us on tonight. We just heard important information regarding our general health care from Dr. Tito Izard, MD. What a powerful session. I invite you to visit her website at ValerieDanielsCarter.com and listen to some of her previous sessions. Let me share with you some excerpts from some of the sessions that you might have missed.
Vision needs personal attention and private space in order to deliver the revelation. I want to say that one more time because it's so important. Vision needs personal attention and private space to deliver its revelation. When you take time to meditate, when you take time to pray, you gain wisdom and understanding. This quiet time allows God to reveal his plan for you. He's able to share with you what's best for you. I want to ask you a question. Tell me, what value is there in having tons of plans that have no relevancy to your life? I used to have a brother, his name was Reggie. We called him Nino's, or I said Nino's because that's the soul food restaurant, but the restaurant was named after Nino. And he would always come up with all of these plans. He'd go through and grab this person's plan or this person's strategy. And I used to ask him, I said, Reggie, what relevancy does that have to what you're trying to accomplish or what you're trying to do? And he said, I don't know, it just looked good. Everything that looks good is not good for you. So don't waste time living out someone else's dream or strategy that was not designed for you. I really want to challenge you to understand you have a human survival kit. And I want you to look in that survival kit and determine what you have in it and what will work for you. Don't worry if you don't have all the money you need. Let me tell you a little secret. Don't you tell nobody I told you this, but I'm going to tell you this. I have never had enough money to pay for my vision. Every time I accomplish something, I seek to do something greater, my resources have never matched my vision. Don't worry about it. Because if you're patient enough and you're diligent enough, things will happen and resources will come. Don't worry if you don't have all of the people that you need. The right people will eventually position themselves around you. They were used to operating their drive-through at a normal rate and a normal speed. But now they had to accelerate it in order for us to be able to get to our sales level. Oh, what did that mean for me? That meant I had to go and challenge our employees and add other employees to the drive-through area. I had to give customers notification that your food is fresh, your food is hot, but I need you to slide forward for a minute so I can get that next customer behind you, because I didn't want to lose focus on my customer. So I had to adjust my strategy somewhat in order to be able to capture some of the sales that I needed. If I had just sat there and said, you know what, I'm just going to let my drive-through run just like it ran in 2019, I would have lost some of the capacity that I needed in order to survive. Never lose the capacity that you need and that you really have to have in order to survive. So, well, how do I gain this capacity? How do I gain this understanding? You do it in a number of ways, but the most important way that you do it is you have to make an assessment of where things are. A full conversation needs to be had with everybody in the company, or everybody in your ministry, or everybody in your family. You need to sit everybody down, and you need to talk about accountability. You need to talk about responsibility. You need to talk about how we need to apply things in order for all of us to be successful. And if they don't buy in to what you need, they're not really good for the team. And sometimes you have to make that assessment. It's not always easy to make that assessment. It may be someone that has worked for you for years and years and years. And now here we are at the midst of a crossroad, and they can't get the big picture, and they're stuck in the past. They may not be the individual that you need to work with you in order to get things done, and you may have to shift and reassign some things in different areas in order for you to behaviorally shift their mindset.
We're so glad you joined us tonight. Please like us on Facebook and follow us on YouTube and Instagram. We look forward to seeing you next week. Remember, you have the power to win with Dr. Valerie Daniels Carter.